Hello and welcome. Today we'll be exploring Refsum disease, a rare genetic disorder affecting the nervous system and other parts of the body. We'll delve into its causes, effects, diagnosis, and management, shedding light on this complex condition. Refsum disease is primarily caused by mutations in the PHYH or PEC7 genes. These genes provide instructions for making enzymes crucial for breaking down a substance called phytanic acid. When these genes are mutated, the enzyme's function is disrupted, leading to an accumulation of phytanic acid in the blood and tissues. The buildup of phytanic acid is the key to understanding the disease. Phytanic acid interferes with various cellular processes, particularly within the nervous system. It disrupts the myelin sheath, a protective layer surrounding nerve fibers, hindering nerve signal transmission. This disruption leads to many of the neurological symptoms associated with Refsum disease. Additionally, phytanic acid accumulation can affect the retina in the eyes, bone marrow, and other organs. Refsum disease is considered a rare disorder. Its exact prevalence is difficult to determine, but is estimated to affect fewer than 1 in 1 million people. It is an autosomal recessive disorder, meaning both parents must carry a copy of the mutated gene for their child to be affected. The signs and symptoms of Refsum disease can vary significantly between individuals and often don't appear until late childhood or early adulthood. Common symptoms include retinitis pigmentosa, which causes night blindness and a gradual loss of peripheral vision, anosmia, the inability to smell, sensorineural hearing loss, and neurological problems such as peripheral neuropathy, characterized by numbness, tingling, and weakness in the limbs. Other symptoms can include ataxia, leading to poor coordination and balance, ichthyosis, a scaly skin condition, and cardiac abnormalities. Diagnosing Refsum disease involves a combination of clinical evaluation and laboratory testing. Doctors will assess the patient's symptoms and conduct a thorough physical exam, with a particular focus on neurological and ophthalmological findings. A blood test to measure phytanic acid levels is essential for diagnosis. Elevated levels of phytanic acid strongly suggest Refsum disease. Genetic testing can also be performed the diagnosis by identifying mutations in the PHYH or PH7 genes. While Refsum disease can be classified based on the specific genetic mutation, it is more commonly described by its classical presentation. This classical form encompasses the core features of retinitis pigmentosa, neurological issues like peripheral neuropathy and ataxia, anosmia, and elevated phytanic acid levels. Currently, there is no cure for Refsum disease. The primary goal of treatment is to manage the symptoms and reduce the level of phytanic acid in the body. The cornerstone of management is dietary restriction, specifically limiting the intake of foods containing phytanic acid. These foods include dairy products, beef, lamb, and certain green vegetables. Plasmapheresis, a procedure that removes phytanic acid from the blood, can be used to quickly lower phytanic acid levels, especially during acute exacerbations. Medications can also be used to manage specific symptoms such as pain from neuropathy. Regular monitoring of phytanic acid levels and ongoing assessments of vision, hearing, and neurological function are crucial. Since Refsum disease is a genetic disorder, there are no known ways to prevent it directly. Genetic counseling is recommended for individuals with a family history of the disease. Carrier testing can help identify individuals who carry the mutated gene and assess the risk of having a child with Refsum disease. The prognosis for individuals with Refsum disease varies. Early diagnosis and adherence to dietary restrictions can significantly slow the progression of the disease and improve the quality of life. However, if left untreated, the accumulation of phytanic acid can lead to severe neurological damage, vision loss, and cardiac complications. Recent research is focused on developing novel therapies, including gene therapy, to correct the underlying genetic defect. While these approaches are still in early stages of development, they hold promise for a potential cure in the future.